Delia Van Prague, and this is Nothing Ventured. Today we have our friend Mark on the show. Hi Mark, how are you?
I'm very good. How are you today, Delia?
I'm doing just fine, thank you. So let's get started. How did you first hear about Venture House, and how long have you been a member?
All right. I found out about Venture House about 2.5 years ago when I started because I was at another clubhouse and there was a counselor there that got let go and eventually ended up here. And there's another member here who went with her, and that member told me to come here. And at first I was a little reluctant, but I said, okay, I'll come and see and take a look at it. And I haven't left since. I mean, I'm very proud. I mean, I don't come 24 hours a day, obviously, but I come probably 4 to 5 times a week. Occasionally on the weekends when they're in house. You know, I mean, I wouldn't have it any other way. This is like the best thing since sliced bread. I mean, it really is.
Awesome. Yeah, you're a big part of Venture House. Definitely like one of the people that you know and your face and you're very friendly too. So that helps.
Right. Thank you, Delia.
You're welcome. What is your diagnosis, and has that diagnosis changed over time?
I was diagnosed, oh God, probably about 15 years ago with schizoaffective disorder.
That's my same diagnosis.
And I'm not on any medication. I'm able to realize when I'm gonna like go back to that diagnosis, and I'll take a breath. I won't keep going, and I was never hospitalized. So
Wow.
that's pretty much that.
Yeah. I was diagnosed with schizoaffective disorder not too long ago, maybe a year and a half, 2 years ago. And I got so excited when you said that because I haven't encountered anybody with that diagnosis.
Yeah.
And it's a tough one, and I take a lot of medication because that's what works for me.
Yeah, right.
Right. Everybody's different.
Right.
And the medication has its own set of troubles.
Yeah,
But
that's for sure. And then I don't have schizoaffective disorder anymore, but I have this problem, and then I'm on that problem. So you're off these pills, but you're on those pills. It's like, yeah.
it's a lot.
But listen, I'm going to tell you right now, Delia, it's better than the alternative. I mean, you need it.
It really is.
Yeah.
And I still get paranoid, and I still have very bad intrusive thoughts. But you work on it and do the best you can.
Right.
So can you tell us a little bit about your mental health journey?
My mental health journey. Oof. Well, when I was young, a kid, I would act out. I would, I went to a residential school setting for 4.5 years when I was between 12 and a half and 17, where other students had similar issues. Then I left and I graduated from my home high school the following year on time. And sometimes I think like I feel like cheated from a public high school, 'cause I was only in that school for 9 months, and I went right out, and maybe what I should have done is like stuck around another year, because it's like when I walk into a new place, you don't know anybody, and by the time you meet anybody, they're going to this school and this going to there and they're going to here, and I also didn't have a lot of friends as a kid. Believe that, if you believe that, that's a true thing.
Wow.
Yeah. And wasn't my social my social lack of social skills, believe me. But it was just like I don't know what it was, but I didn't have many friends outside of the private schools I was going to. And they were all out in Staten Island. They all lived in Staten Island. My mother didn't have a car. I mean, so you only saw them basically in school and whatever. Um, and then I graduated. I went to college. I never finished. And then I
What
worked.
did you go to school for?
I went to school. Well, I went to Kingsborough for liberal arts because I
Okay.
had figured I'm 18. I didn't know what I wanted to do, and rather than going in there saying, "Oh, okay, I'll major in accounting," and then I realized like I don't want to do accounting, then I'm like kind of like locked in. But my original plan was to get an associate's degree and then see what was going to happen after that, and I never made it. Then I went to work. I worked for 7, 8 years, and then they let me go, and the bank was taken over, and you're out, and that's it. And then I did some volunteer work. I volunteered at the Transit Museum in Brooklyn in like early 1993. That's right, 1993. And uh, from there, then I went back to college. I went to LIU in Brooklyn, and the tuition was too much, and I dropped out, and then I started, then I was trying to look for clubhouses, and I found this other one in Manhattan, where I was a member for several years, and then we moved 3 times. I mean, and then brought me here.
Yeah.
And I also did last year. I had the opportunity with Matt to go to Fountain House for 2 weeks for training,
Oh, cool.
and it was best 2 weeks of my life.
Wow.
I mean, it really is. I mean, it's a different situation. Venture House and Fountain House are the two largest clubhouses in the city. And Fountain House, for those who don't know, is a training base, one of 5 in the country. And I don't know how many there are in the world, but Fountain House was the original clubhouse.
Right.
And I'm not going to sit here the whole podcast, give you the whole history, but you can research it. I became a member of Fountain House. I haven't been there in a year, and I think I'm going to, go back there one day. But I feel like so like, not like it's my job here to come and nobody's going to do it, but I kind of feel like so connected here at Venture House.
Yeah.
Last year I went on the family, what is that called? The neighborhood thing they have every year in Staten Island, the family day or whatever it's called. And I told the director there at the time, for Kenny, I was bored out of my mind because there was not really, to me, there was nothing to do there. But here it's like there's things to do. You can walk around. You can go to the patio. You can go take a walk. You're not locked in here.
Yeah. There's definitely a lot to do.
Yeah.
Like I was sitting in CID and the computers were taken and Fabian was like, "Hey, you want to put these punched pieces of paper into a binder?" And I'm like, "Sure."
Yeah, right. It's better than doing nothing. Right?
Yeah, exactly.
Yeah.
What brings you joy?
What brings me joy? Well, amongst other things, being in a situation such as Venture House with people who are friendly, people um I could have a nice conversation with, who I can converse with, and then I tell members here that I look at this as like a job. Let's say you work with 100 people. You're not gonna like all 100 people, so you try to find the people who you have most in common with, and you're I don't mean to be on top of them every minute, but like when you see them, hello Delia, hello this one, hello that one, and then if you know that people tend to tend to like have an attitude, you try. At least I try to stay away. Like, oh, here they come. Let me try to like get away. Let the air clear. But you and I hit it off. As a friend pretty quickly.
Yes.
And I always poke my nose in. Hello, how are you? And
How's mom?
how's mom? Right? That puts a joy on your face every minute. Every time I say that.
I know, it's just so nice. And
Yeah.
my mom was in the hospital
Uh,
when you were saying that, and she's fine now.
mm.
For
And
those listening, she's fine now.
I just
Um,
want to say I've never met Delia's mother, so it's not like we're all friends.
no,
Yeah,
no.
that's good.
So one thing that brings you joy is the community.
Right.
Yeah, totally. I can see that.
Mm.
I had a question. When you were working,
Yes.
did you struggle with your mental health?
Not really. I mean, I was a messenger. I worked in a bank mail room. But it wasn't like like a teacher job. You have to do lesson plans and argue with the kids and deal with the principal and why did you give him this grade? I was basically I would go in the morning, pick up my deliveries, had the whole morning to do them, and then be back by 1 in the afternoon and go home. I mean, that was pretty much it. You know, I mean, if I had another type of job, maybe.
Gotcha. So, so I guess what I'm wondering is, how did you get your diagnosis?
I went to well, actually, when I went to the when I applied for something else, I needed like you need here. I guess like you need in all clubhouses, you need a psychiatric evaluation. And I back in those days, you can call up a psychiatrist to get an appointment. Now it's like impossible. But I got it, and he was asking me some questions, and he basically, he said, I'm going to give you this diagnosis. And I never heard of schizoaffective. I heard schizophrenia.
Right.
And then I had checked it up, and it says it's like this, but there are differences. That's the reason why doctors are always practicing, because they keep changing the diagnoses and the names, and they have like offshoots of a diagnosis, and what used to be called something 30 years ago is now called something else. So if you're outside of the loop, which I am, don't even bother looking at it. You're gonna have a nervous breakdown. But it is what it is, and it got me in here,
Yeah, it
and
is what it is.
and I'm grateful. I really am very grateful to come in here.
Yeah. What's one thing that you love about Venture House?
Well, one thing I like is everybody, and coming from another clubhouse, I can actually say this: the camaraderie here is wonderful. The staff and the members, there is a boundary level, and there's also professionalism. But it doesn't mean I can't see Dan and tell him a joke, or say, I saw something on TV I want to show you. As long as it's appropriate and professional.
Right.
You have to know who you can say what to, who you can show what to, and where, and who's around. Basically my rule of thumb.
Right.
And I'm also very helpful. That you're well aware of that. People come to me and they say, "Where, what do I do? I have a problem." And sometimes I can tell them. Sometimes I could say, "Well, you could talk to this one or talk to that one." If I can give them the advice and it's the right advice, I'll try to help.
Sure. Well, this sort of segues perfectly into what do you love about yourself?
Well, one thing I love is thinking about coming here every day. And there are some days like I have all attention. I'm gonna come. I get up in the morning. I'm like, you know what? I'm a little exhausted today. They'll live without me, and I take today off, and I come in tomorrow. Nobody says what happened. That's another flexibility thing about Clubhouse. You come and go where you want, when you can.
Yeah.
I tell people who I'm giving tours to that I look at Clubhouse like a medical plan. Most people have a primary and a secondary. Your psychiatrist, your therapist, your doctors, your family, and you are primary. This is secondary. So let's say you have a doctor's appointment at 9 o'clock and you have another one at 3 o'clock and you'll finish at 11 o'clock and you're in the neighborhood, you come in here for a couple of hours. I mean, there are members here that I have never met. I've been here almost 3 years. Fabian will tell you there are members who I probably haven't been here for 20 years, but they're on the list. When they walk in, like, I remember you,
Yeah.
But you know what I mean? People have a life. People want to go on vacation. People, God forbid, have a death or an illness in the family. People have a life outside of Venture House.
Right.
And outside of any other thing, they have a life. I mean, unless you're gonna sit like a hermit for the rest of your life in your house, you have things to take care of, and and I'm very glad. From Fountain House came this, and then came the other clubhouses, and and we're expanding. If you haven't heard already,
I've heard.
Yeah, and I told Juliet about a year or so ago, she got money, she got the grants and everything, and I told her, I said, "There's nowhere else for us to go but up."
Oh,
and
yeah.
I mean it. I mean, now the state has loosened the regulations. It used to be that New York State, all the clubhouses were in the city. Now they're in Long Island, they're upstate. So who knows? In 10 years, we may have 5 locations. You don't know. You don't know.
Yeah, the more the merrier.
Yeah, the more the merrier. That's right.
Well, I totally agree with you. I also realized, like, for myself that if I come 2 days a week, I'm good, I feel good.
Yeah.
But if I come 3 days a week, I feel better.
Right.
It really does make a difference.
I mean, like I always tease you when I apologize to do this. You'll leave. I'll be like, "Are you coming tomorrow?" You're like, "Yes." You come the next day. "Are you coming tomorrow?" "No." I'm like, "Why?" But you know what? You do what's right for you. You know what I mean? There were some programs I was in, showing my age. I was in an IPRT program years ago at FEGS. Hello, FEGS. But you had to go there 4 days a week.
Mm.
And one day you were off. And I remember one day I said to myself, "The heck with it, I'm not going in." 5 after 9, I got a call from my counselor. "Where are you?"
Oh,
And I
wow.
told her, quite frankly, I took a day off. "Is that okay?" "No, it's really not. Here you leave for 6 months. I mean, I would keep in touch, but I'm taking a break, and then you come back. They're not like, where the heck were you? No, but you know what? People, need time off. They need, they need a mental time, like a mental breakout.
Yeah.
You sit out on the beach or in the park with a cup of coffee and a paper or your phone and just say, "Okay, all right, it's Wednesday. I'll go back Monday. I'll start fresh Monday."
That sounds like a great scenario with a book and a coffee on the beach.
Yeah.
That sounds ideal.
Yeah. Well, I got the phone. There's a beach near my house, and we'll see about the coffee. But you know what I'm saying? It's sometimes like you get yourself out of the elements.
Truly. Well, I don't think you, not to be rude, but I don't think you really answered my question about what you love about yourself.
Proud of being Mark Rosenberg. I mean, I'm proud to say that, I have the experience of previous clubhouse experience. I also am, as I said, I'm knowledgeable about a lot of things. I have a good sense of direction. I have my moments, but that's another thing. I mean, my jokes are well, I don't want to say they're wonderful because that would be grandiose or conceited, but I think they have their moments. As well, like my mother would say, as long as I don't try too hard. Sometimes like he feels like I'm trying to like get a laugh, you know. But I do keep them professional. I do keep them clean, and I do keep them appropriate for the setting. I would say think I'm rather funny. I try to get people to laugh, but only if it's an appropriate joke, if you will, and the language is set to stay clean. Because after all, this is a work environment.
You have one you could share? You have one you're ready for us?
Well, just yesterday, I was in Cocoa Bean, and there was a member who went to Jesus and said something in Spanish, which meant, can I have a cup of coffee, please? He said something, la 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 la, por favor. So the member walks out. I went over to Jesus. I said, if I asked that question, I wouldn't say da 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 por favor. I would say da 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 por me more. Jesus said that's very funny.
It is funny. Da 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 da.
But whatever the Spanish phrase is, I don't know it.
We know you do a lot around Venture House, around the clubhouse. But what are some specific things that you do regularly?
Well, I generally, nowadays, I generally do the attendance. I work reception. Occasionally, I'll run or co-facilitate meetings. I'm known to give tours. You know, then I'm just like every other member, taking time out, hanging out.
You do the news too, right?
And I do the news, that's right. The news Tuesday mornings at the end of the morning meeting. The plug.
Is there something that we haven't touched on that you'd like to share? Or you think that you pretty much got it all out?
I would just give a word of advice to those listening. Don't underestimate yourself. Don't say, "Oh, I'll never be able to do this, or I'll never be able to do that." Maybe you won't, but maybe you will, and it doesn't hurt to try.
Absolutely. Beautifully said. That is all we have today. Once again, I'm Delia Van Prague. This is Nothing Ventured. This is Mark. Thanks for doing this, Mark.
You're welcome anytime.
Appreciate it. Alrighty. Have a mentally healthy day.